Welcome, everyone. My name is Nina, and I am the founder and CEO of Pre-Health Shadowing, and I am so excited to welcome you back here for another virtual shadowing session with Pre-Health Shadowing. If you don't know yet, Pre-Health Shadowing is a nonprofit organization that is student-founded and student-based for the advancement of pre-health students. We're really here to provide flexible and accessible learning opportunities to students everywhere. Our goal is to help break down barriers to get into the field of healthcare by allowing students to explore all of the different possibilities of healthcare in a low-risk environment. Pre-health shadowing is 100% virtual, but can lead to in-person opportunities. So stay ambitious. And let's get to the next part of this. We do have closed captioning that is available for all students to accommodate students of all abilities and needs. If you have any accommodation requests, feel free to email us at info@prehealthshadowing.com. Additionally, we do send out emails, so be sure if you didn't get an email today, go ahead and check your spam folder and save Pre-Health Shadowing as a contact in your email inbox, and this will make sure that it goes straight to the inbox and skip the spam box so you never miss a session. If you also want to keep up with us, we are on social media. We will post all of our live sessions as well as other opportunities on our Instagram, TikTok, and Twitter, aka X. And you can follow us and even post on there. We're also on LinkedIn, where you can tag Pre-Health Shadowing on LinkedIn for the opportunity to get reposted and expand to our professional network. Pre-health shadowing serves students globally, over 66,000 students to date, and I'm curious, where are you calling from today? Go ahead and throw in the chat. I'm currently in Northern California. Welcome, everyone. If anyone here is interested in being a part of Pre-Health Shadowing is a 100% student-based volunteer nonprofit organization. You can apply to be a part of our organization as a volunteer. We currently have about 5,000 student volunteers all over the world that are helping make Pre-Health Shadowing a reality for students everywhere. There's different things that you can do, from helping out with web design to content creation to writing articles to even leading live sessions, what I'm doing right now. You can help us book speakers and help with grants and funding. The possibilities are endless, and you can even start your own project. You can register as a volunteer on our website, prehealthshadowing.com/volunteer, to learn more. And we will help with training and professional collection, and this is also a great way to get letters of recommendation. We are also recruiting for our leadership team. This is also 100% remote and does require more of a time commitment, anywhere from 5 to 20 hours a week, where you can still make your own schedule. Our leadership team works closely with me and members of our advisory board and our professionals to help make pre-health shadowing a reality and manage our volunteer teams. We do have different positions available and different departments, which you can explore on our website, prehealthshadowing.com/join our team. And we help with professional development and more. So if any of you guys are interested, definitely check it out. Like I said, it's 100% remote and great for applications in the future. For those that are high school students, Pre-Health Shadowing also has an opportunity for you to start a Pre-Health Shadowing club on your high school campus, allowing you to be in a role of president, secretary, or treasurer and work to support other peers that are interested in learning more about healthcare. You can fill out the interest form if you look up high school training program on our website or on Google, Pre-Health Shadowing HTP. Diversity is a foundational key of what we're doing here at Pre-Health Shadowing. We're really working to break down barriers to get into healthcare. And through this, we are looking to recruit professionals from different fields in healthcare, different backgrounds, different interests within the field. And so if anyone is interested in helping us with outreach or helping us support this initiative, please, please, please get in contact with us. You can also nominate professionals. So if there's anybody that you want to shadow, maybe this could even be in person, but you don't know how to connect with them, go ahead and reach out. You can nominate them on our website, prehealthshadowing.com/nominate, and we will reach out to them for you, allowing you to shadow them virtually and then maybe even get an in-person professional connection. Not only that, but you can also get volunteering hours for helping with outreach. So definitely check it out. We're really looking to expand what we're doing here at Preal Shadowing. We serve all fields of healthcare, and all students are able to join. Preal Shadowing is 100% student-based, volunteer-led, and we rely off of the help and donations of our community. We humbly ask that you take this time to pull out your phones, scan this QR code. If you are financially unable to donate at that time, please send this to someone in your community who is dedicated to supporting your education. Preal Shadowing is here to uplift students, but it does cost money. And so if you have contacts, please share this with your community. You can also get volunteering hours for helping us with fundraising if that's something that you're interested in. So please go ahead and scan this and share this with your family members or even school administrators as well. Throughout today's session, you can go ahead and type your questions in the chat. We will be having a Q&A session after the presentation today, and we encourage you to take good notes. We do have a post-shadowing assessment that will occur after our live session today that will be available on our website at the end of today's shadowing session. If you pass the post-shadowing assessment, you will be eligible to receive a certificate that verifies your hours with pre-health shadowing today. And last thing, if you are able to at this time, we do encourage you to put on your camera. This is great to see all the students face to face, and we know that it's not always possible, but if you are able to, go ahead and share your camera. If not, we will go ahead and continue for today. I am honored and privileged to welcome our professional, Dr. Reagon. Thank you so much for joining us today.
You are very welcome. Thank you for having me. This is an honor for me.
So we'll go ahead and get started whenever you're ready, Dr. Reagon. Go ahead and share your slides. Students, while she's doing that, I encourage you, go ahead and put where you currently are in your journey. Are you in high school, first year undergrad, second year? What are you studying? Go ahead and give yourself a little intro in the chat.
Okay, and for some reason, my sharing slides went away.
No worries. Take time.
You know, I've never had this happen before in Zoom, and now I'm feeling old. So I'm not really liking this at all. Because I'm looking for my share my screen, and it's now disappeared. So give me a second, please. Thank you. First, I want to say thank you so much for having me. This is truly an honor because I have been part of these programs for so long that I think it's fabulous that this is a nonprofit, that this has people coming from all over the world. This is an excellent way to build your network. And you'll see in my slides when I talk about social capital, this is the beginning of social capital right here, because amazingly, you will run into people who are in similar fields and you're like, wait a minute, weren't you in so-and-so? And 10 years ago. And then you might come across each other in medical school or in your doctoral program or in a master's program. So please stay in contact with each other. And this is fabulous. I'm going to turn my camera off when I start this, only because I fidget a lot. My ADHD kicks in. And so my nervousness kicks in. I've been doing this a long time and I'm almost 50. So for me, I have to tell you, sometimes it just doesn't go away. But I will turn off my camera. But when we go to Q&A, I will absolutely turn on my camera and have a great discussion with you all. Okay, so to get started, the views and opinions do not represent the agency that I work for. They are solely my own. And I just need to always have that disclaimer there. So let's talk about my path to public health. And this is always important when I'm talking to students of all ages and even in adults of all ages, right? Because the path, sometimes there's an unknown future. My path to public health was not, I didn't even know I was supposed to be here. I didn't know what I was doing half the time of early in my life, but I knew I was working, right? And I was working from a very young age. So I had interrupted undergraduate work for 6 years, and I had a lot of real world experience. And then I realized I didn't have a bachelor's degree, and I was told while working at a hospital, and I was overseeing an entire neurological unit and two fellowships in pediatric neurology and spinal cord injury fellowship, that I needed to get a bachelor's degree. One, I was told I was too smart not to have one, but they couldn't promote me if I didn't get one. So I said, you know what? Let me go back to school. And that restarted my path where I finished undergraduate, 2 masters, and a doctorate degree, right? And I started my path into healthcare administration, never realizing I was going to turn first to medicine and then to public health. Never realized that from a clinical or fieldwork perspective. So your path is your own, and there's going to be so many different paths you can take. But if you keep your eyes on a prize and allow yourself to be open, you will definitely, doors will open in ways that you never even thought. The other thing is, when I was in healthcare administration, I kept feeling like I wasn't fulfilled. Like I was not pushing myself, and that, yes, I was good at what I did, but it didn't fulfill me internally. And so I left healthcare administration and found my passion in public health, specifically global health in orphans and vulnerable children, rural health, and infectious diseases. And so for me, it was, I finally found what I'm truly interested in. And I have to tell you, my next book, because I said I'm closing this book and my chapters are done, the next book that I'm starting, and that's how I look at my life, as different books that I build chapters in and move on, is going to be something that is a little bit different, but it combines all and the totality of my experiences. And so remember, you're not in a race against anyone. Do not compare your path to others. This is your path. This is what you are intended to do. And it's okay to take different paths to get to where you are. What I will say is choosing the right institutions for education is key. Where you go to school is your return on investment. Your alumni network is going to be key. Being known in the field is going to be key. So when you're choosing undergraduate or graduate schools, make sure that you're choosing the right programs, that you're choosing the right programs that are going to give you a return on your investment. That's key, because especially when you're going into medicine or public health, people you go to school with and the alumni network are the ones that give you your opportunities as you move forward. So keep that in mind. So now I'm going to talk a little bit about my path once I got to public health. So I went to Tulane University as an adult student, a very, very adult student. I didn't start Tulane till I was 33. And I didn't think I was graduate level ready. I didn't think I was smart enough to do graduate level work. And everybody kept saying, stop doubting yourself. You're having imposter syndrome. This isn't accurate. And so I said, well, let me see if I can, start in a Master's of Arts program and see how I do. While I was in that program, I found, okay, I can do this. Let me apply to a Master of Public Health. I've always been interested in maternal and child health, and Tulane University is the first school of global health in the world, and has a huge network across the entire world. They also are a leader in maternal and child health. And I said, okay, so let me see if I can go ahead and apply to this program and get in. And I got in. And it led to so many unique opportunities. That's where I really found my passion for global health. And because of the university and the different research awards it has, as well as the students that were in the master's program and the medical program and the doctoral program, different students started organizations to help different communities in different countries and in the United States. So I was at the time a Cowan Scholar in New Orleans. So I was able to teach students about AP Prep. And then I started a public health leaders program in high schools. And so there are different things that you can do, but that network is going to be key, and where you go to school is going to be key. So, while I was at Tulane, I said, okay, wait a minute. I'm done now in 2013. I started my doctoral program in 2013 at Georgia Southern University. And while I was in my doctoral program, a person that I was familiar with, we hung out a couple of times at Tulane while we were in school, but we weren't super close knit, said, hey, there's an evaluation fellowship opening up at the CDC that I think you'd be great for. And they're asking us, do we know anyone? Do you mind if I recommend you to apply to this? And so I went ahead and applied. And while I was working on my doctorate, once I finished all my doctoral programs and passed my competency exams, and while working on a dissertation, I started my fellowship at the CDC. And so I was a fellow there until 2018. And in 2018, now while I was a fellow, I got to work across different programs, but I ended in global health, which then later, years later, as you can see, I ended back in the very center that I ended my fellowship with because they wanted me to apply for a position that opened up. After I left the fellowship and graduated from Georgia Southern in 2018, I went to the Defense Threat Reduction Agency, which is part of the Department of Defense. And in the Department of Defense, the Defense Threat Reduction Agency covers global health security agenda and all biological threats, chemical and nuclear threats that would affect the health and wellness of United States citizens. So I worked with them, and I, got to go to Northern Virginia and work in DC for a little bit. And then my old team lead from, the CDC fellowship called me and said, hey, there's a position I think you should apply for. Now, if anyone knows anything about the federal government, it's not like private sector where you can submit your resume and that's it. It takes time, and you have to go through a lot of scrutiny to get in. So it took about 8 months before I actually got an interview. So I, stayed in Defense Threat Reduction Agency, and then returned back to the CDC to do global health work in the Division of HIV and TB. And I'll go into a little bit of what I did later on. And then while at CDC, we were able to deploy out for specific missions. And I deployed out for COVID-19. I was a COVID-19 responder. I'll go into that a little bit later. Then I deployed out to be Operation Allies Welcome Responder, which was a unified coordination group through Homeland Security. And then I left Global Health to join the Division of STD Prevention. So that's a little bit about my path and how you got to be open to what's happening out there. So what do I do in my role? Well, let's look at it. I get to travel the world, and those are charts right there. And in this picture, we were in Zimbabwe, and we were going through validating data of how many patients were actually on HIV, right? And so what we do is we work with the CDC country office, we work with USAID, we work with HRSA, and we work with Peace Corps in identifying people living with HIV, getting them tested, treated, and virally suppressed. And so that's what I was doing. So this is me and my colleagues. And what's interesting about this picture is my colleague who's sitting directly across from me with the glasses, she and I went to our doctoral program together, and she ended up joining the evaluation fellowship after I did. And after I was done, and she ended up working at CDC, but she joined Global Health after I did. Now, we didn't know all of this at the same time. And then when I saw her, I was like, hey, I need extra people to go to Zimbabwe with me. Are you interested in going? She had never traveled to a different country for public health purposes. And that's what I'm saying. Who you connect with in school absolutely matters. This is us in Nigeria. This is me in Nigeria. This is my entourage, because Nigeria is definitely a country where you need it depending on where you're traveling. This is what our charts were looking like when we have to move them from this to electronic health records. So I get to do that and help countries move from paper records to electronic health records, but also get to help them clean up and make their clinics more efficient. That's a very big thing. And that pulled in my experience from my hospital administration days. This is us talking about nursing coverage and what nurses are experiencing. And then, of course, we have fun. This is my team in Angola. We decided to go see the rocks that are ancient. And so we were having a good time and going out to see it. And then I helped draw schematics. So as you'll see later on, I was out on Navajo Nation during COVID, and I helped identify the path for COVID testing and patients identifying, because Navajo Nation spans 3 different states, and it's its own nation within the United States. So it has its own president. And so we needed permission to be there. And so we were identifying how patients were coming in to the different states as well as entering the nation and what was happening. And so I now lead, and I've always led, monitoring and evaluation, right? And the monitoring is very, very important. And the evaluation team puts into practice the 5 primary buckets of activities that you see on this slide. Starting at the top and working our way around, we co-develop and implement cooperative agreements, monitoring plans, and cooperative agreements are essentially an agreement. We put out what's called a notice of funding opportunity, and you apply for it. So it's as if you're applying for a grant, but it's not a grant, but it's like a grant or a contract. And then you apply for it, and we have a team that reviews all the applications and then decides who gets funded for federal funding. And what we do is we evaluate the effectiveness and impact of these different cooperative agreements. We translate data that we receive into visually appealing and easy to understand reporting. And we offer prompt actionable data to all the relevant stakeholders to drive program quality improvement. We build our capacity of our recipients through technical assistance, and we provide consultation across different divisions and different centers within the agency. We are called the Centers for Disease Control and Prevention. And the reason why we're plural is because we have different centers that focus on different areas, right? So I focus a lot on translation, and this is key as you do anything in life. You could have the best data, you could have the best collection, you could have the best presentation, but if it's not tailored to your audience and you can't translate the products and give the key takeaways, people just won't understand it, right? And so this is what we spend a lot of time doing. We spend a lot of time working on program briefs and reports and guidance. And we do a lot of data visualization and storytelling. So imagine you're going to 6 different countries and you have to tell the story in each country, as well as then link the common thread through all the countries so that people understand where their tax dollars are going, but also understand what's happening at a global scale. That's what we spend a lot of time doing. And we deal with quality improvement. We're always looking at what is the best way to improve the quality externally and internally. So now let me get into some of the fun stuff, right? Because quality improvement is cool, and this is giving you a kind of insight into what I do. But let's talk about the deployments, because most students like to see that when you're in a position, you can actually still go and do other activities and other things to keep you interested, engaged, and learn new things. And what deployment really means, especially when we're talking about a pandemic. That's very key. And so I often get asked, what's a deployment like, right? And how did you transition to a deployment, and how did you adapt? And the thing is, this is why I put the learning curve on there. As everyone knows, with COVID, there was a lot going on, and I was what was considered an early deployer going out. And so I was sent to the field early to figure out, how is this spreading? Why is it spreading? How can we mitigate this? All of those different things. So we always had to think and act quickly with precision and on our feet. We had to review every document carefully in rapid time. There was nothing that was set in stone, as you all probably experienced, of things kept changing. And then it was always important to have advisors outside the agency that could give you different perspectives. And the key thing is that success was measured differently by different people. As you go into medicine and public health, and whether it's nursing or becoming a physician, or a physician assistant, you're going to see success is measured differently by different people. A neurologist will measure success differently than an internist and a neurosurgeon. And so that's always important to remember. So when I tell people, what is deployment like? And if you're thinking about taking the MCAT, and you're thinking about going to medical school, you're thinking about going into field-based public health, these are the things that you need to remember, because you're going to have to be able to think on your feet and think very quickly, and you're going to have to be able to process in real time. So while I was, deployed, these were the different deployments that I did. So I did the health department task force in Pennsylvania, which meant that I was in the different meat packing and poultry and mushroom plants in Pennsylvania. And I traveled throughout Pennsylvania, and we worked on infection prevention control in the actual plants. You can see a picture of us there going, through plants. And I went through all the meat plants, walked through carcasses, saw chickens. Like, I had to see the whole process because we had to know how things were spreading, right? And then we had to review the epidemiological data at the same time we were doing the mitigation and then put recommendations. The next two deployments were both at Navajo Nation Health Command. And I had never worked on a reservation before. I had always interacted with different members of the community, but never worked on a reservation and understood the autonomy that a reservation had. And I showed you briefly on work to support a document process for Navajo Nation. We developed new formats for leadership. We did actionable data reporting. We helped Navajo Nation stand up an emergency command center. That emergency command center was included FEMA, it included the National Guard, it included Doctors Without Borders, it included locally community-based organizations, it included multiple entities of the federal government, because some of you may remember how tragic the deaths were, and how many deaths were happening in Navajo Nation at the time. And so we were working through to, one, create metrics so that they could watch what was happening and understand what's called gating of, are cases increasing, decreasing, where are the hot spots, etc. So we were doing that in real time, but we were also traveling to the different clinics. So one part of, even though I was based in Window Rock, I would travel to another clinic that would be 5 hours across the nation, right? So you travel through Colorado, Utah, and then you get to New Mexico, and you're like, there's Arizona, right? And so you're going through Navajo Nation, if you look at it on a map, is very huge. So when I had to travel to clinics, sometimes I had to stay overnight, etc. But this was important for me to get to know individuals who worked for Indian Health Services, which is a federal agency, and also members of the Navajo Nation, and understand from a culturally relevant perspective what guidelines we were putting out that just did not resonate with the culture of Navajo. And that was very key in saying, you can't tell someone, well, you must isolate, when there are people living in a trailer, and there might be 8 people living in a trailer. There's no way to isolate. So you have to set up FEMA tents to isolate. Or people are still practicing sweat lodges, and so they still would come together, and because this is part of their culture. So we took a lot of time to work with the elders in Navajo Nation and put together different types of tailored messaging so that we were culturally relevant and culturally sensitive as we were giving out messaging and working through. And that, I have to say, in all of the things that I've done in my life, has been the most rewarding. And I still stay in contact with a bunch of people from Navajo Nation. And then I ended my deployment for COVID in the Incident Command Center. And so this was like meeting Tetris, because the Incident Command Center is the center that is responsible for the entire COVID deployment across the entire world. So if you ever get a chance to go to CDC, you'll see all the screens in front of you, and you're monitoring 18 different screens, and you're paying attention. I was able to set up meetings with, I had the Chief of Staff of Israel on my WhatsApp. So I was able to set up meetings with the UK and all these other things, and be involved with guidance and help socialize the guidance with the Joint Information Center that passed the guidance up to the White House for review. So these were experiences that if I did not step out there and say, yes, I'm interested in doing this, that I wouldn't have had a chance to do. And there are some people that are at the agency that have never done any of these deployments. So I say all this to say, always take the opportunity when the door opens because you don't know what it'll translate to. Another deployment I did was Operation Allies Welcome. And this was huge. This was Operation Allies Welcome was coordinating the ongoing efforts across the federal government to support vulnerable Afghans, including those who worked alongside the United States in Afghanistan for the past 2 decades as they safely resettled into the United States. So Operation Allies Welcome was the Department of Homeland Security established a unified coordination group that reported directly to the Secretary of Homeland Security and coordinated the implementation of a broad range of services, including initial processing, COVID-19 testing, isolation of COVID-positive individuals, vaccinations, and additional medical services, and screening and support for individuals who are neither U.S. citizens nor lawful permanent residents. This opened up my eyes of the first time we had what was almost akin to a refugee situation on American soil. And so these were the different things that public health challenges, and I was the lead for CDC, sitting at a table of the Marine Corps, the United States Army, Air Force, all of the NGOs that support refugee resettlement. I met people from all over the world. I learned phrases in Pashto and we had to take our messaging and translate it into the 2 languages that Afghans speak, into Pashto and Dari, right? And everything you see in public health challenges, this is what we were facing day in and day out. And so I always had to be on top of it, understand my data, understand how numbers were coming in. And then we had to do mitigation. How do we stop the spread of all of this? Who do we talk to? We had so many different people at different bases around the United States that this became a huge effort. And I also met wonderful individuals who, at the core of it, definitely have service at their heart and understand. So this is something that a lot of people didn't know was happening in the US, but actually did happen. So I'm going to pause because I'm going to switch now to career advice, right? And I'll pause because there may be some questions in the chat, and if that's okay, I'll look at this, but I want to get into some of the career advice because this is where I truly shine, and I know that students want to do that. So I'll pause for a second and see if there's any questions I need to answer immediately.
Looks like we got one in the chat. What is your best networking tip?
Oh, I'm going to get into that in this next session. The next section, I'm going to get into that, and I will get into it, but I'll start with knowing who you are and what you want, and your elevator pitch is going to be key. Your 30-second elevator pitch. If you and I were to meet in an elevator and I said, tell me about yourself in 30 seconds, you need to have that ready. So that's what I'm going to say, and then we can talk more about that during the Q&A, if that's okay. Any other questions? Okay, I'm going to move on to the next section, and then we can go back. All right, so now let's talk about some career advice. This is find your journey to success. And the reason this is important is because this is a comfort to growth zone. Growth begins at the edge of your comfort zone. This diagram illustrates the journey from the comfort zone to the growth zone, right? It's a progression that requires courage, persistence, and self-awareness. So when we talk about a comfort zone, if you look at the stage there you feel safe and in control and unchallenged. It's tempting to stay in that zone, but that's what leads you to stagnation. And growth demands stepping beyond those boundaries. When you get out of your comfort zone, you get into the fear zone, because the first step out of comfort is often fear. You may feel self-doubt, you make excuses, you let others' opinions hold you back, but remember that fear is temporary, and every step forward weakens fear's hold. When you step out of fear, you go into your learning zone. And the learning zone is key. This is where the transformation begins. You face challenges, you develop new skills, and you expand your perspective. Here, mistakes are opportunities to learn and grow. Do not beat yourself up over mistakes. Think about what you can learn from them. And remember, this is a journey. You're supposed to learn along the journey. And when you're at learning zone, and remember, there's no set time for each of these things, and there may be multiple things you're working on that you're in different zones depending on your comfort level. And when you get out of that learning zone, you're going into the growth zone, right? This is the ultimate destination, right? The growth zone, this is where you find purpose, you set ambitious goals, and you realize your dreams. Every challenge you overcome in the previous zones builds a foundation for this stage. So don't be afraid to take risks and believe in your abilities to succeed. Understand that not every door is yours to walk through, and that is okay. What's important is finding your unique path. I know that sounds very like, oh, yes, here we go. And everybody says that. But take it from me, who's had a very unique path and didn't even know I would end up in this field. It's okay. And it's okay to say, that's not my door to walk through, but this is my door. And that door may help me get to the other door that I really want to get to. So it's okay. Cultivate your soft and hard skills to prepare yourself for opportunities. This is going to be key. And remember, social capital. Your relationships and connections is a powerful tool that can open doors you didn't even know existed. And I'll talk a little bit more about social capital on the next slide, because this is very, very key. Every opportunity I have received has been through social capital. I didn't even know they were opportunities out there, and that is key. So if you don't take anything away from this slide, what I want you to take from is growth is a process, not an event. Take the first step today and keep moving forward. Growth is a process, not an event, and keep that in your head. So social capital, why is this so important? When I teach different university classes, and when I used to teach, while I was in school and also while working at the CDC, I was an adjunct professor. I would always open up my courses with the importance of social capital and why we're doing things and why you need to get to know people in your environment and in your classes. Social capital is one of the most valuable resources you can cultivate. It's the positive value derived from connections with others and connections that build trust, foster collaboration, and open doors to opportunity. The reason why this matters is because you're establishing leadership. When you offer advice, resources, or support without expecting immediate returns, you build trust and a reputation for being dependable and skilled in your field. This positions you as a leader in your community or professional circle. Social capital also helps foster reciprocity, right? And giving to others creates a network of mutual support. When you provide wisdom and you share opportunities or connect people, they are more likely to support you in return when you need it most. Always creates a stronger team, right? And social capital strengthens the teams and creates opportunities for collaboration. It builds relationships that are honest, mutually beneficial, and rooted in trust. It also is natural networking. So unlike traditional networking, which can feel forced, right? You have to go, you sit down, you have to talk to strangers, all of that. Social capital thrives on authentic relationships. It's about connecting with people in meaningful ways, both online and in person, while supporting their endeavors and sharing their work. So that is not a forced traditional networking. It's more of natural networking, and that's what you want to strive for. Also, it helps with depolarization, right? So in our increasingly divided society, building social capital helps bridge divides. The more we engage and understand one another, the more we can challenge our biases and create unity. This was very important. When I was going to school, I went to Northwestern University in Chicago or Evanston, Illinois. And one of the hardest classes I ever took was the psychology of weird beliefs. And in that class, for my final paper, I had to argue for female genital mutilation. That was one of the hardest things I've ever had to do in my life when it came to schoolwork. Throughout this whole class, the professor challenged us to read different things and say, now put yourself in their shoes. How are you going to say this is rational or irrational, knowing their side? What that did was build a foundation for understanding cultural differences. It made me less judgmental, and it also helped me look at how people have different biases, how people have different ways of approaching things, and say, okay, let me look at it from their perspective. How can I see where they're coming from? And then still maybe prove my point or bring them along to my point, or even say, you know what? I see where you're coming from. If we tweak this, can we meet in the middle, right? That's the big thing about diplomacy, is you always want to meet in the middle. So social capital allows you to do that and really depolarizes a lot of situations that can be polarizing. And I learned that and had to do that a lot being in a global space, as you're a pseudo health diplomat, you're going into different spaces, you're coming in with ideas, you have to work through that. And then also during COVID and during, Operation Allies Welcome, you have to be able to bridge and say, where are we coming at polar different opposites and how can we meet in the middle? So to build your social capital, actively contribute to your field, engage in dialogue, support others' work, and be honest and trustworthy in your relationships. Social capital isn't just about what you gain. It's about the value you create for others and the connections that grow stronger because of it. It's truly extremely important. And those who are successful in any field have a large social capital footprint. Let's talk a little bit about skills and leadership, because everyone often says, well, you got to have the hard skills, right? You have to be an epidemiologist. You got to be a biostatistician. You have to, know how to surgically do things correct. Those are your technical skills, right? That's your hard skills. But soft skills is what makes you successful, right? So you have a combination of, you could be the great technical expert and nobody wants to talk to you. Nobody wants you on their team, nothing else, right? So now let's talk about the skills and leadership that are foundational elements of professional success. And they encompass the 3 critical areas that I have on the slide. It's soft skills, hard skills, and leadership qualities. So soft skills, these are the intangible yet powerful traits that shape your work ethic and interpersonal interaction. Whether it's identifying your peak productivity hours to maximize efficiency or demonstrating resilience through challenges, mastering and marketing these skills will set you apart. Think about how your entrepreneurial spirit and critical thinking can help you innovate and solve problems and add value. When I was in hospital administration, I was over the residency programs, right? So I was over pediatric neurology residency program. And then when I moved to Mount Sinai in New York, I was over the physical medicine and rehabilitation program. And those residency programs are what you apply to once you're done, while you're in your 4th year of medical school. And it was very evident when we looked at different applications, there's something on paper, but then when people come in for interviews and we would have our committee meetings, soft skills would come up, right? Are you going to be able to deal with the challenges that come with being a resident? Are you going to be able to, think critically and solve problems and add value to the medical team and your fellow residents as well as attendings? Those things always came up. Now, the hard skills, we often know about those hard skills, right? These are technical and job-specific abilities like proficiency in tools such as Excel or statistical softwares like R or Power BI. And so by continuing learning and enhancing your technical expertise, you can stay ahead of the competitive job market, right? Budgeting and other field-related skills are practical tools that drive results in any role. So I always tell people, regardless of what you're going into in the health area, you should know budgeting. You should know technical skills related to your field, but you should also know statistical packages, right? Whether that's R, SPSS, SATA, Excel. Everyone should know Excel because it's used across the world, but it's used in so many different things. And now as medicine is becoming data, well, not becoming, but increasingly data driven, you want to be able to say, I know how to do that pivot table, and I know that this is right or this is wrong, and I know how to read articles and interpret it and apply it to what we do. So like as a DrPH, I know how to do complete research from beginning to end. I know how to design research. I know how to do surveys. I have to do all of that. But what I do also have to know is what's more important beyond statistical significance is how do I apply that research in the real world? How do I take what I've read, learned, or researched myself or evaluated and make it a real world application to make a difference and a change in the world? My hard skills are very important for that, right? But soft skills intertwine with that because you have to know how to think critically. You have to have some self-discipline. You have to have strategic thinking. Those are all important. And you can't do a lot of that without leadership, right? So leadership is often misunderstood as an abstract, and whereas leadership is deeply rooted in actionable traits such as communication, decisiveness, and cultural sensitivity. These are qualities that foster collaboration, build trust, and guide teams towards shared goals. So emotional intelligence and the ability to mentor others further cements your role as a leader. So if you all are starting to do this now, this is key. And it's all things that you can put on your AMCAS application, on your on your applications after you take the GRE, all of this. This is what you can put, and this is what people are looking for in the next generation of healthcare leaders. Remember, leadership is not confined to titles. Every skill you develop contributes to your ability to inspire and lead others effectively. So now I want you to take a moment and put in the chat, before I get into lessons learned from everything that I've done, ask yourself, what do you want to achieve? And how will each decision you make today get you closer to the life you envision? I always say, success is not a single destination. It's a journey made up of small but deliberate steps. Each step you take propels you toward the next one. So it's inspiring growth and progress. Think of your journey as a logic model or a roadmap. It's a clear, actionable plan for where you want to be in the next 5 years, whether it's personally, professionally, and financially. Take a moment to visualize where you are right now. What does one step look like for you? How can the summers you have left serve as milestones to achieve your goals? And I think in terms of summers and not years, because when you start thinking in years, you're like, I got 40 years left, I'll be good. When you start thinking of summers are finite. And you start going, wait a minute, I only have 40 summers left? Wait. I gotta do some things that I want to do in my next 40 summers. So if you think of it in that way, you might think a little differently about your progress and your goals. And for every peak and valley that you see here, this represents growth, learning, and resilience. So embrace the process and stay focused on the bigger picture. And again, ask yourself, what do you want to achieve? How will each decision you make today get you closer to the life you envision? That is key when we're making any decisions, because too often we think, okay, I want to be a physician. I want to be a doctor of public health. I want to be an epidemiologist. I want to be a PhD researcher. I want to be a clinical researcher. I want to do all these things. And then roadblocks hit and you're like, oh no, I didn't do as well on the MCAT. I got to do it again. Or, oh no, I hit OChem and I have to take OChem 3 times. Oh no, I didn't do as well. I have to do this. And we get bogged down in that, but don't give up. And sometimes we don't always win the gold the first time. If the Olympics teach you anything, it's keep going. Your first hurdle, you may miss, but you may end up winning the race. You may not get the gold this year, but you got the bronze. You're getting closer. So keep that in mind as you think about what you want to achieve and how will each decision you make today get you closer to the life you envision. I'm going to go in a little bit into lesson learns about my key insights from public health experiences. Diplomacy matters. That is key. From everything that I've done in public health, diplomacy matters. Diplomacy, respect, and listening, and a sense of humor will open more doors than knowledge. This is where I'm getting back to that social capital again. We can always find the right people with the knowledge, but if the door isn't open, you won't be included, engaged, or involved in making an impact. This is where we often say, I want a seat at the table, but someone has to give you a seat at the table, or you have to form a coup and take it. But regardless, diplomacy matters, and it goes a long way. When you're dealing with anybody in leadership or in any organization, and you have someone that is very busy, and this will come in handy when you're doing rounds as a medical student or a resident, the bottom line up front, that is called bluff. It's an approach to help leaders quickly understand critical information and ensure your data is high quality and streamlined for maximum impact. When I was a hospital administrator, I would have back-to-back meetings throughout the day, and often people would have to catch me walking the hallways to get to another meeting. And in that time, I would have to make decisions. So they can't sit there and give me a whole bunch of data that doesn't make a difference, or not give me what they want the decision on up front, because we only had 2 to 3 minutes to get through something. So it was very important to have that. Remember data simplification, and this is for all my EPIs and biostatisticians out there. This is key. Develop concise, action-oriented data documents tailored for non-public health stakeholders, and that includes physicians. The majority of physicians are not trained in public health. They also are not trained in data and how to interpret data. They are not trained on those things. So you need to be able to say, how can I make this as easy for physicians to understand? And that was big during when we were developing guidance. That's big when you're writing articles. Remember, you want your information to resonate with everyone. And always a 1 to 2 page focused document resonates more effectively with non-public health organizations than traditional situation reports. Engagement strategies. Always involve your health communicators to involve public understanding of health guidance. That means vaccinations, immunizations, anything that is going to affect a human being, you want a health communicator involved in it. What we often see is when people go into physician offices, they hear the physician talking, but they're not understanding what the physician is saying, and they're not asking the right questions. And we want to change that, right? And so health communicators can help through training physicians, and you have more getting involved in medical schools and universities now to help understand how to really get people understanding the guidance and what you're communicating with them. Always focus on equity. Developing health guidance considering health equity principles and equality principles. This is very important. And I'm sure in any of your classes, they've gone over the difference between equity and equality and how they are not the same and why they both need to be addressed in whatever you do, regardless whether it's health, economics, whatever it is. Equity and equality should be addressed separately, but yet together to make sure you do the best thing. The other thing is, as I mentioned before, is valuing different perspectives and experiences. Embracing diverse perspectives enriches public health strategies and solutions, and recognizing that everyone brings valuable knowledge and expertise, even if it's outside public health or medicine. You want to honor people's lived experiences. You want to listen to their insights and integrate their approaches for stronger health outcomes. That's very important because too often we get stuck in honorifics, we get stuck in our degrees, and we're thinking, oh, well, they don't really have, but that it could be a community gatekeeper, that could be someone who has so much more experience than you do, and you have degrees with no experience, and they can really help you a long way in reaching communities or patients. And that's what we really want to do. And so the life lessons that I'm going to leave you guys with is embracing different choices, right? This is important. You want to seek scholarships. You want to explore free opportunities for educational funding and personal growth. You all are in an unprecedented time where there is so much quality education materials on the internet for free now that it's amazing. If you can get certified in artificial intelligence, if you can get certified in data science. It doesn't matter if you're going to become a physician in public health, a hospital administrator. Those two areas are going to set you apart for the next 20 years. It's going to be key. And there's so many certificates that are out there that are free. The other thing that a lot of people forget is you got to budget while you're in school, and you got to budget wisely, right? You got to adopt smart financial habits and avoid unnecessary debt. This is why I'm saying seek scholarships. And you want to start investing early, even if it's $25. You want to start investing in assets that generate passive income for financial security. Had I known this earlier on, I would have been taking $25, $50, $100 and investing earlier in a Roth IRA, investing in stock markets early on while I was in school, while I was a hospital administrator. These are things that I didn't know, and you guys have so much information at your fingertips now that is so key and important for you to start doing that, because remember, your paths change. You may not stay in this forever. So you want to be able to have flexibility and freedom to move about the cabin, as they say on the airlines, right? You don't want to be tied down, and you don't want an albatross around your neck. And too often that comes in the form of student loans or credit card debt. And so make sure you have your freedom there. Value yourself, recognize your worth, and don't hesitate to demand what you deserve. Now, I always get, in people that are in my generation, they're like, wait a minute, you're telling a lot of young people to do this and they don't really have the experience. I'm not saying demand something that you don't have. What I'm saying is, you know what you bring to the table. And if you're bringing to the table something, and always remember this throughout your entire life, demand what you are worth and demand what you deserve. That is key. And especially when I talk to young women, when I talk to Black women, Latino women, Indian women, Asian women, African women, and men of different races, I say, please recognize your worth and don't hesitate to demand it, because someone else may not recognize it and they're going to undervalue you. And you don't want that. Facing rejection. You guys are going on a difficult path. There's going to be rejection along the way. Just embrace it as a stepping stone. It hurts. It does hurt. Don't get it twisted. Rejection hurts. However, it's not a setback that you think it is. You keep going. If you never ask, the answer is always no. But if you ask and you know that the answer is no, you can find out, well, why is the answer no, and what do I change differently about it? So remember, embrace rejection. It's okay. You're not going to get into the school you may necessarily want. You may not get into the residency program you necessarily want. You're not getting the fellowship program or the job you necessarily want. That's okay, because there is something else out there. Travel often. Prioritize adventurous travel to enrich your life experiences and perspectives. This is key. Travel outside of your comfort zone. Remember that model. Travel outside of your comfort zone and do as much volunteering as you can that allows you to ingratiate and really envelop yourself into a different culture. This is going to be key in order for you to clearly understand what's happening and do. So now we're going to get to the fun part, which is questions. So I'm going to stop sharing my screen, and I'm going to turn back on my monitor, not my monitor, my video, sorry. And now we can get to questions. I'm trying to find where I put you. Please tell me I'm still here. Here we go.
Awesome. Thank you so much, Dr. Reagon. We'll go ahead and start off with the questions. Students, because we have about 30 of you here today, if you would like to turn on your camera and unmute yourself to ask your questions, you are more than welcome to. I'll go ahead and ask the first one that is in the chat, and that is, what motivated your working on electronic health records in Nigeria?
So that was actually a directive through our agency. What motivated that, and actually Nigeria is one of the premier countries with electronic health records that we work with HIV. It was a directive that we had several different clinics that were reporting different numbers, and we worked with the Ministry of Health over there to say the best way is to start going from paper to electronic health records so that we can really start tracking patients, but also providing comprehensive clinical care. And so that was really a funding and agency directive that got us working with electronic health records in Nigeria. The reason why I was brought into that is because as a hospital administrator, I started implementing electronic health records back in 2000 when it wasn't even cool. And so I was a subject matter expert for the hospital and Epic medical records in rolling out, having hospitals in the United States going from paper to electronic records. So by the time I got to Nigeria and we worked on this, I had over a decade of experience of taking hospitals from paper to electronic. And so it really helped, and what I brought to the table made a difference in it. But it also was something different. We're talking about an entire country versus one hospital, right? So we had to phase it. And so now Nigeria has biometric electronic health records, which is more advanced than what we have here in the United States. So it's actually quite interesting, and they really have taken this very far. And I'm very, very happy to see their progress over there.
Wonderful. Thank you so much. All right, students, who would like to ask the next question? You can go ahead and unmute yourself.
I can ask my question.
Okay.
Hi, my name is Neka. I'm a recent MPH grad. I got my MPH in epidemiology recently, and I work as an epidemiologist now. So, woo. I'm about like 2 years post grad, and I'm kind of thinking of pursuing a higher degree, and I'm stuck between a DrPH and an MD. So I was wondering what your deciding factor was on, I guess, pursuing a DrPH other than other degrees.
It was having a conversation during some interviews that someone
Okay.
said to me, you are more set for population health than individual health. But by the time you get done with medical school and residency, you can make a greater impact in public health. And at the time, I didn't think my nerves were set up for medicine, even though I took the MCAT to get into my MPH program because I was all set to go to medical school, right?
Huh.
The
Okay.
interviews and everything, right? So what was very interesting is here I am graduating from an MPH program, trying to apply to a doctoral program. And they're like, you have to take the GRE. And I was like, why? And they were like, because that is the determining factor. I said, but that determines if you can do graduate level work. I have 2 master's degree. I can do graduate level work. They're like, you got to take the GRE. So in my last year of the MPH, I was like, I have to take the GRE. And I studied and I took it and, got in. But what I will say is the deciding factor has to be you, what it is you want out of life. When people say, do you have a regret? I don't really say this is a regret, but I think I should have pursued the MD, MPH, or MD, DrPH route and combined the two. And the reason being is there are some things that even though I can clinically get in this world, sometimes the MD is listened to a little bit more. And I say that to everybody. Even though we're providing the guidance to the MD, it's still that thing. So it depends on really what you want to do, because you can do public health with an MD, but MD allows you to do consulting if you want to on the side. Like I do public health consulting, I did it in the
Yeah.
past, but it allows you a little bit of flexibility globally in a different space and clinically, right? So it's up to you on how you want to pursue that. Just be ready for the steps that come with it. Someone said, well, what are you going to do next? And I was like, oh, I might go to medical school. And someone laughed there because everybody's like, you've been in school forever. And I was like, I get it. But, it really depends on what you want to do and what you're ready to do and what you want to commit to as well.
Mm-hmm. Okay. I've been having like the conversations and reaching out. I mean, that's how I found this opportunity as well. So thank you. I appreciate it.
You're welcome. Are there any other questions? I think I see one in the chat now. What has been the most significant challenge you've encountered along your public health pathway? Recognizing that not everyone is trained the same. And not everyone has the same passion. You may think people start off with the same passion, but over time it changes. And so you're like, well, why aren't you as passionate about this as I am? And, why didn't you understand this? And not everybody had the same training you had. So you can't make an assumption that all degrees are the same. It really depends on where you go. And so what I've had to do is really, because I'm a perfectionist, I've had to come back a little bit and kind of change and really hone in on my diplomatic side and my teaching side to bring everyone up to where I am, or recognize when I don't know something and I need to be taught something and I need to learn something. And so for me, it's understanding that, and then also recognizing that cultural awareness is not ingrained in everybody. Cultural sensitivity is not ingrained in everybody, even in the world we work in. And so people will say things that you are taken aback by. And you're like, well, how could you be in the same field I am? And you said that. But you just, it's something that you have to deal with. And so just be flexible, because sometimes people will say things that challenge your soul. And you're like, okay, I can't react, but I do have to redirect, and I do have to help us move forward. And not only am I trying to change the program or the outcome, I have to change the individual that is maybe working with this. And so that's been a big challenge. Another challenge that hit me was biostatistics. Biostatistics was a very big challenge, and I thought when my MPH was done, I was like, woohoo, I made it through biostatistics, thank you. And then my doctoral program hit, and I had to do 2 semesters of biostatistics and inferential or experiential epidemiology. And I was just like, what is this? And so, however, I really delved in, and now I can just call a biostatistician, but I have a knowledge there that's important, and a knowledge in epi. And so for me, it's those two things that really did throw me for a loop, and I thought I wasn't going to make it out, but I did. And I did a lot of biostatistics in my dissertation, so I'm proud of that. But those were really, some significant challenges I've encountered. Everything else you can kind of, go through. But is there anything specific you wanted to ask with that? No? Okay. I'd like to hear from some of the high schoolers here, because this is fascinating to me that you guys, and as I said, I started a high school pathway program. And so I'd love to hear from some of the high schoolers here on what you're interested in doing, and how are you so involved already. This is very fascinating to me. I don't know if high schoolers want to actually talk, but I don't think they do.
Awesome. I have a question for you, Dr. Reagan.
Mhm.
What was the most difficult thing you've experienced professionally?
Racism. That's actually racism and sexism. Those were definitely 2 things. And you don't think of it in the same way, and it happens. And it's subtle or overt, in either way. And I've had to be in situations where I could say one thing and a man will say the same thing, and the man gets the praise. Or I've put in the work, but a man will come along and do certain things, and then they get all the credit, and so that's happened. It's getting better than it was early on. And that's professional across the whole spectrum of all my careers, right? It makes it a little bit difficult. Those are 2 very real things that people face. And, you know, I hope it gets better, and I hope it doesn't take a step back in the coming, you know, years. But it really is something that has been difficult. And people taking credit for your work is very hard to see and react to professionally in open situations, or someone, you know, sitting there and they get listened to when you said the very same thing. But if any of you have worked on in a group project, you know, there's always people who do more work in a group project than others. And, you know, but everybody gets the same award, the same grade, right? And so, you know, just keep that in mind as you go through.
Thank you.
Ooh, orthopedic surgeon. Okay, I saw someone say they want to be an ER doc. That's great. That's a wonderful, wonderful thing to be, and it's shift work, so that makes it even better. But I have a lot of friends that are ER docs, and they do enjoy it a great deal. Research and conducting each step. Can you please talk about how public health research may be different than wet lab research, and if you have experience in both? So research, the fundamental processes of research are the same. It's a scientific method, right? There are different aspects between wet lab research and public health research, depending on what you do. A lot of the stuff we do in public health is considered non-research determination, and then the other side is strictly research, and that is basically the same as you would do whether it's clinical research or in other areas. Processes, methodologies, rigor, all the same. Allowing someone to reproduce your work is very key. Now in public health, it's a little bit different because your work may not be generalizable depending on how you set it up, but that's also going to be key in why we have gold standard research that can be generalizable, and you'll learn more about that when you get into school, versus others that are not. And so you always want that there. And so it's very similar, almost identical. The steps, you're going to follow the same scientific method and rigor in both. And it just depends on what you're actually doing and what populations you're working with versus other. I haven't done animal research in a very, 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 very long time. So I think it's one of those areas where it's still the fundamental is the same. Ethics are always built into everything we do, whether it's population, animal, lab, specimen. It's always a, you know, what we do. Now, as an ortho, you want to go into ortho, you want to be bone. I think that's what it said, right? You want to be an orthopedic surgeon, and that's quite interesting and very exciting. And you'll work with physical medicine and rehabilitation docs and a lot of physical therapists in ortho. We need more people in ortho, so that's a very good thing to go into. How can someone with less ability to get along with difficult people be more diplomatic and tolerant? Ooh, that's called practice and knowing who you are and what you believe in, but also really practicing diplomacy. And there are different courses you can take for diplomacy that will help with that. What you can do is, remember when I talked about understanding where the other person is coming from? Sometimes people are projecting often. And so sometimes you want to take a step back and really understand where this person is coming from. And, you know, say, I hear what you're saying. Am I understanding what you're saying? And this is what I'm understanding you to say, right? Because the tolerant level is all relative. You know, it's kind of like hitting the threshold. What your tolerance level is. So if you find yourself at a lower threshold, you want to work on that patience, and you want to work on the listening, and you want to do some exercises that help with that. And online, there are some exercises that can help with that. However, it is, I haven't always been this way, and my friends will tell you that, and people I've worked with will tell you that. So over time, it gets better. In our youth, we tend to be a little more, you know, have little less ability, but then you realize some skills start creeping in. You realize, you know, honey gets you more flies than anything else. So you learn how to change over time. Otherwise, you find yourself isolated or people not working with you. Did that answer the question there? Okay, Evelyn, not a high schooler, but wondering how I can be pursuing career in public health or any experience that helped get started in the field. Well, what you can do is you can start with community-based organizations. You can start with groups like this. You can start volunteering at different organizations that work in the communities, your local communities. Right now, we have a lot of need for people who remember domestic violence is a public health issue. We have gun violence, we have opioid abuse. So there's so many different areas that you can start getting involved in, even if you're talking maybe about sex education or health education or, you know, obesity or exercising. Those are all different ways. So what I would start doing is looking at your local organizations. You can look at the national organizations like American Heart Association. You can look at American Public Health Association and see what's out there. You can also reach out to your state health department or your local health department in your areas and say, you know, you want to start volunteering and see if they have any volunteer mechanisms for you to do that as well. So I would start really using networks and start reaching out to people to get involved. The other thing is, oftentimes you can start your own public health experience because there's always things in our neighborhoods that are public health related, and you can start your own group and organization. You can do it in school, you can do it in college, you know, you can do it through a religious organization. So there's different ways that maybe you're like, you see a need that no one else is addressing, and you can go ahead and start that as well. So you can do that. Okay. We're high school and senior, what a general view of all, okay. Considering becoming an ER tech or getting a job somewhere, I can get experience and knowledge of a little bit everything. So Paris, I would ask, why are you considering that? And since you are in high school, depending on where you are, you could look into a lot of high schools have an EMT program that you can take in 11th and 12th grade that you can become a certified EMT, which would get you a lot of experience. They also have medical assisting programs. So you could do that while in high school and then continue working while in college and then continue on into medical school. So I'd be interested to hear why you want to be an ER tech or, you know, experience a little bit of everything before going in, because it's not necessary. It's always not necessary. And sometimes we put some additional roadblocks in front of us that maybe we don't need to have because we think we need the experience. The other thing is you can ask about volunteering at a hospital and see what they allow you to do so that you can see different things across the board. So Paris, do you have any follow-up or anything you'd like to say before I go on to the next one? Sorry, my automatic feeder for my cat is going off. Okay, I'll move on to NECA. You said, yes, that is great. So there are so many scholarship programs. For those of you that are in undergrad and those of you that are in your graduate programs, I want you all to look into the Boren Scholarship and the MHIRT Scholarship. So MHIRT is MHIRT. It's a Minority Health, I think, International Research Training Program, but it's MHIRT. The other one is called Boren Scholarship. Too many people don't apply for this. For the MHIRT program, you do not have to apply only at the school that you go to. You can apply to any school that has MHIRT. The issue there is if no one applies to the school that has it. So for example, I had a friend at Tulane who wanted to apply to MHIRT. Tulane is a very competitive MHIRT program. I was working at Mount Sinai at the time in New York, and I called up the person who was over the MHIRT program at Mount Sinai, and I said, can anybody apply to this? And she said, yes. I said, wonderful. I said, you know, have applications go? She said, I haven't received a single application yet. Well, MHERT loses its money if nobody applies, right? And so the money just goes away. So you have programs out there that has nobody applying to it. So always apply, because you never know. If you're the only person that applied, as my friend was, you get accepted. And she went to go do research in South Africa for the entire summer, got paid a stipend, got paid all her travel expenses, everything else. So always do these different things and apply for programs that are out there. Morehouse has great programs out there. Tuskegee has great programs out there. So you definitely want to apply for different programs and not just look at the programs that are at your school. All right. So how did I deal with misogyny as a female leader? And do you see that it has been decreasing? With more women are taking on higher responsibility. You know, that's interesting. I feel like it has been decreasing, but it comes in different forms. And it's a little bit more subtle now than it was, 20 years ago. It's a little difficult at times because sometimes you internalize it. And I did that a lot when I was younger, and what's wrong with me? Why is this happening? All these things. And, is it something I did? And then I really learned what misogyny was, because I didn't have a good idea of it. And I say the youth are much more empowered and much more vocal and much more strong and much more knowledgeable than I think I was. And so I really applaud you guys for that, because I'm always amazed at how intelligent and how you all really stand up for yourselves. And so it took me a while to get to there, because when you suffer from imposter syndrome, you always are like, well, if I say this, what will happen? Do I really belong in this space, etc.? And so you kind of, let it happen. Whereas now I don't. I call it for what it is now. And that's what it is. I call it for what it is. So, that's where it's at with that. Okay, I see, Paris. Leave people without a diagnosis, or at least a prediction, and come up blank when I do think of what to do. Oh, no. You'll learn all that. You're thinking way too far ahead. You'll learn all of that. And that's also why you have to go through years and years of residency. Because when you graduate medical school, you know very little about your specialty. But when you do your intern year, you learn a little bit more. And as you go through it, you'll learn a lot more. So definitely, you will be able to learn more. And you will have people supporting you and teaching you all throughout residency. So don't let fear distract you from where you want to go, or make you take extra steps that you don't need to take. So just keep that in mind as well. Now, with how busy you are in life, how do you personally balance and make time for yourself? So had you asked me this about a year and a half ago, I would have said I don't. My friends and family would have said she doesn't do that well. Now I have made it a priority. As a matter of fact, I'm going to meet friends after this. I've made it a priority to say my work is not my life. I am passionate about what I do. I care about what I do, but it is not my entire life. And I have to make time to put my oxygen mask on first. And I have to really take pride in what I do personally and family. And so I've started doing more engaging things in my personal life and setting boundaries at work. And so for the longest, I will say for 20 years, I did not balance it well. And I'm just getting to a point where I'm starting to begin the balance in the right direction. So I didn't do it well, and now I'm starting. So making time for myself now looks like I have a calendar. I try to keep it as firm as possible when I can, and I block time for reading, coloring, writing, exercising. I love Pilates. I go do that, and I walk every day, because I have to do these things to stay sane and to stay at my sharpest. That takes time, and it's very hard when you're in a graduate program or even undergraduate, and you're trying to do so many things and make yourself competitive for top programs and everything else. But what I will say is always find time for your health. Always find time for your mental health. When your body says rest, you have to rest. Even when it's in the thick of finals, you have to say, wait, I have to take a little time. Because if you don't, you're going to run yourself ragged and you're still not going to perform as well. So when your body says you need a nap, take a nap. That's very real. Now, had you told me this before, I would be like, no, I can't do it. I have so much to do. I got this paper to do and that to do. I got this to grade to do. And I was bananas. Don't let yourself be that way. And I'm going to leave it as that. So, Kaylin, I hope that answers your question. You're going to have to look at the EMT programs as, yes, Natalie, that is perfect, where the community colleges are. And also, yeah, usually the community colleges will offer programs, especially if you're homeschooled, but also see the connection of what schools you may be connected through the homeschool network. And there may be a program there in your state that you can do through being homeschooled. Okay.
Amazing. Thank you so, so much. Those were amazing questions for our students. And thank you so much, Dr. Reagon, for going through and answering those with such care and depth. For all of my students here and for everyone watching this virtual shadowing session asynchronously, I'm going to go through now with a quick wrap-up presentation, which is going to go through the next steps that you're going to take as a pre-health shadowing student. So before we get into getting a certificate and all of the opportunities that we have, I want to take a quick snapshot. We've just finished another virtual shadowing session, and I really want everyone here to think about, one, the reason why they're even here. What did you get out of this today, and how did this inspire you? What next steps are you going to take in response to what you've learned today or what you've absorbed today from the session? This is very crucial for your success in the future, whether it be writing personal statements or finding your why, or just remembering, what your why is for going into the field of healthcare. So I encourage all students to take a moment and take a snapshot of how they're feeling, what they're learning, and just what they're thinking right now. And if you'd like to share that, you can go ahead and shoot us an email. If you're interested in getting published, we will post and repost on our website, on our LinkedIn, and even on other social media platforms. So if you're looking to broadcast your message or your thoughts or your takeaways and highlights, feel free to reach out to us and we'll help facilitate that for you. LinkedIn is a professional social media platform. Dr. Reagon talked a lot about ways to network and how to increase social capital in this professional world. LinkedIn is a great starting space for students. If you don't yet have a LinkedIn account, you can create one for free today. And this is a way where you can expand your social network. You can find pre-health shadowing on LinkedIn at pre-health shadowing and tag us in any of your posts. You can see here we have students who are talking about their experience doing virtual shadowing and what they are learning and getting from this and how they're going to apply that to the future to even pursue in-person opportunities. Once again, if you're interested in being a part of our team, we are taking students just like you to help us grow pre-health shadowing. You can volunteer on your own time asynchronously from the comfort of your home, prehealthshadowing.com. Once again, we are completely student-run and student-focused. We are relying on the support of our community. If you felt like this session was helpful for you today, please go ahead and take out your phone and scan this QR code. You can donate directly or you can share this with someone who will help support your education on your behalf by providing opportunities for students everywhere. Thank you, everyone. You can also access this on our website, prehealthshadowing.com/donate. Now, the moment everyone's been waiting for. How do we get my certificate? You're going to go to our website, www.prehealthshadowing.com, and you're going to find Dr. Reagon's page on the website. It'll be right there, smack dab on the home page. You can go ahead and click on that. A lot of you are already there, which is how you got here today. What you'll do is you'll go to the post-shadowing assessment, and you'll take a 10-question post-shadowing assessment. You will have 2 chances and 30 minutes to get over 70%. Upon completing this and passing, you will be eligible to receive a certificate that verifies your hours with us today. We encourage you to download this certificate, keep it somewhere safe, and also to put your reflection right underneath it. A pre-health shadowing tip is to have one long Google Doc with a summary of your hours at the top, every single shadowing session that you've attended with a link to your certificate and your reflection right under it. This will come real handy when you are getting ready for your applications down the road. If you missed any part of the session today, your Wi-Fi cut out, you were in class or tutoring, or you were working, or you were sleeping because you're on the other side of the world, don't worry. Pre-health shadowing records and uploads all of our sessions both to our YouTube channel and to our website, so you can access it at any time asynchronously. For all of my students that are watching asynchronously, you can still take the post-shadowing assessment and get a certificate. We are currently on a shadowing marathon right now. We have 5 shadowing sessions in a row. This is our 3rd one in our marathon this time. We have 2 more, one on Monday, one on Tuesday. If you are interested in catching those, go to our website, prehealthshadowing.com, to sign up right now for those sessions. And we also have a ton of sessions already booked for January. So I encourage you to get ahead, get it on the calendar, start planning for it, and we will be adding sessions all the time. So make sure to check back often, follow us on social media, and stay cool, guys. That is it. Thank you all for being here. Big shout out. Thank you, Dr. Reagon, for joining us and for the amazing time that you spent with us today and sharing helpful tips about your journey and how to get out there in the world and network and accomplish your dreams. That's all for today. I'll stick around for a little if anybody has any questions about PHS. If not, I hope everyone has a great weekend.
Thank you. Happy holidays, everyone, and thank you so much for having me. I'll
Thank
talk to you guys
you.
again eventually. Have a
Bye,
good one.
Dr. Reagon.
Bye-bye.